I first realized what was going on a long time before the doctor did. I just noticed that he wasn't as responsive. He was my second child. And I kept saying to the pediatrician, something's wrong, and he kept saying, oh, don't be silly.
And you'll never forget the moment because the doctor would not look you in the eye. He took us into the room and said that he probably had suffered a stroke in utero. The right side of his brain was basically gone. And he would probably start having seizures. The frequency of Nick's seizures was rather terrifying.
We tried everything and nothing worked. And then when this new therapy, VNS therapy, came along, number one, it seemed to make sense, but it actually lessened the seizure severity and frequency. And then the magnet, he starts to have a seizure. You go like this, swipe the magnet across where the box is, and it just stops.
The VNS therapy is the only therapy that we've actually encountered that has had a noticeable and practical impact, positive impact. In terms of Nick's future, it's a lifesaver.
It has given us hope, and I think it's given him hope. It's helped him to feel independent because he doesn't feel as helpless, and because the caregivers all carry that magnet with them, he feels safer. He feels like even if he does have a seizure, it'll be okay. So I think it has given him some independence.
As an example, during the last 3 weeks, he's had 2 episodes. And the last 2 were aborted within the first 2 or 3 seconds with the use of the magnet. You contrast that with his history of seizures over 31 years, and we're talking, he was averaging around 180 a year. With the VNS technology that we've been talking about, by lessening the number of those incidences, going from 180 or 160 or 140 per year down to maybe 10, 20, that's going to have a definite impact upon your body, your brain, your muscles, your organs, everything. And that would be a great help, not only for Nick, but it'd be a great help for people in Nick's situation. And I'm sure there are a lot of folks out there in Nick's situation.